please explain to our viewers the role of the ISHRS.
Well, the ISHRS started nearly 30 years ago now, so it's been going a long time. And it was started by a group of forward-thinking hair surgeons who wanted to share knowledge with each other and also to bring in other people into a collective group. Now, the kind of three pillars that they set up were education, research, and collegiality. And those things are really what underpins how the society runs itself. So, for example, in the educational field, we have an annual congress, a World Congress, and this year it's going to be in Panama City, and that's our 30th one. So we're going to have some great celebrations for that. We also, throughout the year, have a number of other things. So there's all sorts of learning that can go on throughout the year. So even if you can't get to the annual Congress, you can do lots of stuff online. So there's a basics course. There's an advanced course that is used as well for learning for doing the board exam, which we can talk about a bit later. And there are webinars where people can get CME points, ACCME recognized points for their continuing medical education that we all have to do to keep our licenses. And then there are other things like live surgery workshops, and we try and do at least one of these a year. And then the other thing is that we have a global society. So back in 2003, the ISHRS started a global society in which they invited all the presidents of the either national or regional societies around the world to join and have a common goal of discussing issues in their region, needs among their local members. So this has actually helped to kind of spread the word, and the ISHRS does collaborate with some of these Global Council members, of which there are 24 members throughout the world at the moment. So that's another way of spreading the teaching. There's another course that is done at the St. Louis University every year, and that course is partly hands-on with cadavers and also teaches basics both to physicians and to their assistants. So you can see that, you know, on the educational side, there is a lot of scope. There is things as well like the Forum Journal. So we have a journal that's now on EPUB, and members or even non-members can send in articles. And it is peer-reviewed to an extent. We do like to have a lot of informal communication as well through the journal. So that's just looking at some of the educational side of what the ISHRS does. And, you know, to me, I've been to one less meeting than you have, Bob, so I'm not quite as experienced as you. I've only been to 29 of the 30. But, you know, the thing is that many years ago, I was asked the same question. You know, why do you keep going? And, you know, in my mind, when you stop learning as a physician, that's when you should hang up your degree, or as a surgeon, hang up your scalpel, because there's always something new. There's always some tips that you can learn from each other. So if we then move on to the next pillar of the ISHRS, that's research. So we do have research opportunities for people to get grants from the ISHRS, and every year there's between 20,000 and 60,000 available to give out in grants for you to do a research project. So even if it's a small scale project, not necessarily, you know, something that's a high level, and you want to kind of do a little bit of research and present it, there's that opportunity. So, you know, there are things that we can do to help our members to learn. And then collegiality, the third pillar. So I've already talked about the Global Council and, getting involved with the local issues and local societies. And, this plus the World Congress and all these meetings. In the World Congress, we have between 600 and 800 attendees that come every year. So that's a lot of people to network with around the world. And one thing that I find really valuable with that is that I have patients who travel and or they move countries. And if I want to find someone to carry on with their care, I know somebody in their part of the world, and I can contact them and say, right, my patient so and so is coming, either on holiday or they're coming to travel, or they've got a problem. They've gone on holiday and they've got an issue with their surgery, and I can easily find someone that I can send that patient to. And, the other thing is that, when you travel around the world, it really is nice to be able to meet up with friends, go to another country, go to all corners of the world, and you'll know someone from the ISHRS who lives there. And it's just a great way of kind of communicating both on on a professional level, but also socially. So, that and more, I find ISHRS is just the go-to place. I suppose the other thing that's really, really important that the ISHRS does is patient education.